So this is Louise. Louise is 33 years old and she presents with early signs of moderate soft tissue and skeletal aging. So what I can see here is a little bit of hollowing at the side of the piriform aperture, a little bit of widening of the base of the chin, and very, very early changes with volume depletion in the lip itself. So I'm going to approach this with some soft tissue filling intradermally along the vermilion border, which will help structure and shape the lip, and a very small amount of volume placement into the body of the lip itself. So the vermilion border is a dermal structure, and it's a junction between the white lip of the upper labial zone and the red vermilion. And the junction between them is a specialized tissue that has no melanocytes, no sweat glands, no hair follicles, no dermal appendages at all. So it's often seen as a thin white line running all the way along the edge. Now it's a dermal structure, so we need to inject intradermally to provide support to that area. So it's very important that we use a 30 gauge needle. A 27 gauge needle is too big for this area and we'll end up with inferior product displacement, causing product to go into the submucosal or the subdermal fat, which can bleed into the upper labial zone. This 30 gauge half-inch needle from TSK is perfect for injecting superficially within the dermis. So I do a retrograde injection, very small amount of product required, and then we just follow it along. So my second entry point is at the tip of the first one, which means we're in an area which is partially anesthetized by the lidocaine that's in the product already. And we're going to follow it all the way up to the tip of the Cupid's bow. And you can see how superficial I am, that you can see the entirety of the outline of the needle through the skin. Okay, open your mouth slightly for me. All right, so we're just going to continue this process with the lower lip, again staying intradermally, as superficial as it's possible to be. And just following that vermilion border along. Placement of tiny, tiny strands of this filler. It's only possible through a 30 gauge needle into the dermis. Okay, so far, with just this side of the lip, from the commissure to the center, I've used 0.2 cc's of this filler. Do the same on the other side. Okay, so same process. Superficial placement. Getting the product into the dermis as opposed to the subcutaneous really helps structure and support that definition of the transition zone. Okay, again continuing with the superficial placement, vermilion border lower left side, And one last area is this one here. Okay, so that was the vermilion border done with about 0.4 cc's of a low viscosity, highly cohesive product injected with a 30 gauge TSK half-inch needle. So we've created support by the piriform injections and the mental injections. We've given structure to the vermilion border. Now the last stage is to put a little bit more volume into the lip. Can I get a 23 gauge needle? And one of the advantages of using a cannula over a needle in this area is that from one single entry point, which I'll be making at the commissure, I can put 1, 2, 3 strands underneath the mucosa of the upper lip. And they'll all be in the same tissue plane. And because of the nature of the product that I'm using, I'll be able to mold them together into one cohesive mat or sheet in the lip area. I'm going to use a 23 gauge needle to make an entry point at the commissure. And the cannula I'm using is a 25 gauge 1.5 inch TSK Steriglide. And one of the great things about this one is if you can see me extruding product, it's coming right out at the tip of the cannula. A lot of other cannulas have that hole, have the extrusion point a couple of millimeters further down. So that means when I can see the tip of my cannula through the mucosa, I know exactly where my product's going. There we go. Now the great thing is that it glides very easily. It's so easy to introduce, it just slides through the tissues. This cannula has a coating which allows it to glide through the tissues, kind of like a lubricant. Okay, so that's 3 strands. 1 close to but not under the vermilion border, and 2 further down. And we can just mold those together into one cohesive product. Look, that's great. From the same entry point, we can flip that round and enter the lower lip and do the same process. We're only doing very small volumes in each pass. Second pass. And then another one in between those two. Okay. So, single entry point, placement above, placement and below, all in the same plane. And there's 0.3 left, so we'll just do the same on this side. So, same process repeated on this side. Entry point at the commissure, 3, 2, 1, there we go. So just as soon as you're through the skin, we can flip this into the upper lip. One strand a little bit higher. And then another strand just a little bit lower. the same process. So we're not significantly augmenting the lips here. I don't want to make them look unnaturally large. It's just to add that very slight amount of volume that's lost as we've naturally aged. So the last thing is a little bit of descent of the oral commissure in this area here. So what we'll do is put a little bit of an injection just underneath that area. It's going to do two things. It's going to smooth that line out directly, but there is a little fat pad just under the corner of the mouth here that we can start to revolumize and lift the corner of the mouth up. Okay, could I get the antimicrobial TSK ice mask, please? Okay, so this is the TSK ice mask. It's an antimicrobial mask that can be used before or after treatment. Okay, so it's for the whole face, but I think what I'm going to do, because we just did the perioral area, we'll just fold that round on the lower part of the face. Okay, let's have a look.
First of all, we're going to treat the lips, so the white lip and the red lip and the vermilion border. I'm going to start with the vermilion border to strengthen any weakness that we can see that leads to these little development of perioral lines whenever the patient kisses or says oh or whistles. So what we're going to do is start at the oral commissure. We're going to use a 30 gauge TSK needle, which is really important in delivering the product to the correct plane. So this is an intradermal placement of the product at the vermilion border, so the junction between the white lip and the red lip. We're going to insert the needle and we're going to keep the 30 gauge needle in the dermis, so very, very superficial. And we're going to deposit no more than 0.025 of product. So most of today's products have got local anaesthetic in them, so this is a comfortable injection technique, as well as the fine gauge of the needle, making it a very comfortable product placement. Okay, our second placement of the product is where there's already some anaesthetic because of the product. We're going to maintain this in the vermilion border intradermally. We can see how superficial this is because we can see the grey of the needle. And we should be able to see blanching of the tissues as the product is deposited intradermally. Okay. Okay, we're placing the product upon withdrawal of the needle. And we're taking the needle right up to the cupid's bow. So there should be pinpoint bleeding at the insertion point. This is a very comfortable technique, and it's also very predictable with regards to the lack of bruising, so long as we're in the right plane. So again, we're bevel up, 30 gauge TSK needle, and we're injecting intradermally at the vermilion border in between the junction of the red lip and the white lip. And maybe we can see that because we're intradermal, that the product is going to flow into areas of weakness within that dermis, already filling the perioral lines without us having to directly treat them. We can treat right into the vermilion border of the Cupid's bow. We can lose some product through pores because we're in the dermis. And it's quite important for this technique that we use a low viscosity, high cohesivity product. So this is replacing the structure within the vermilion border and giving strength to that vermilion border without actually really creating any significant volume. Okay, and we'll start at the lower, and we'll just repeat the same technique, keeping the needle really superficial so that we can see the grey of the needle and we can see the product being placed within the dermis. We need very small amounts of product, no more than 0.025 per pass. We're not trying to create volume, we're trying to create contour and definition and strength. So for this technique, you can see that I'm replacing the needle every third to fourth pass. This is to ensure that the needle stays really sharp so that we cause minimal trauma and minimal swelling to the tissues and minimal risk of bruising. To create a little bit of definition and restructuring of the philtrum columns, we're going to follow the same philtrum columns that the patient had originally, which we can see. We're going to inject the product again intradermally using a 30 gauge TSK needle. There is some resistance as I'm placing the needle, but this feedback just reassures me that I am in the correct plane intradermally. So it's imperative that we use a needle when trying to inject intradermally. A cannula will preferentially fall subcutaneously, and the 30 gauge needle is perfect for the product placement intradermally because of its size, and also because of the ease of passage through the dermal tissues. Okay, so we have now created contour and strength across the vermilion border. And now we're going to do the second technique, which is to create shape and volume within the red lip or the vermilion. So I'm going to use a 23 gauge introducer needle. This is a 23 gauge 3/4 inch TSK needle which comes with the cannula. So if you just open slightly for me, Celia, a little bit more for me, perfect. I'm going to just, thank you. This is 25 gauge 1.5 inch cannula. Okay, so we are in the submucosal plane. The cannula passes effortlessly right up to the Cupid's bow. We're putting very little pressure on this plunger in order to get the cannula into the right position. We're approximately 2 millimeters below the vermilion border. I'm using a medium viscosity, highly elastic product, and I'm going to inject 0.05 mLs of this product upon withdrawal back to the oral commissure. So this is going to give submucosal support and also create shape and definition. So I've repositioned my cannula, I've come a little bit more into the body of the lip, more inferiorly, and I'm going to inject again 0.05 as I withdraw. And finally I'm going to reposition the needle just slightly more inferiorly again, and again you can see that the cannula is just submucosal and it's passing effortlessly through the tissues, creating minimal trauma and allowing for a predictable placement of the product in this submucosal plane. I'm just going to press this product so it flows together to create a little blanket of hyaluronic acid in the submucosal fat, creating natural shape and volume within the body of the lip. For placement of product within the body of the lip, we're going to use a 25 gauge 1.5 inch cannula. I'm going to use a 23 gauge introducer needle. If you just open slightly for me, Celia. Okay, so we're just literally going to make an insertion just at the oral commissure. I'm going to get my prime 25 gauge 1.5 inch cannula. This is a Steriglide cannula. The reason I use this cannula for the product placement in the submucosal plane is one, because of the ease of glide of this cannula. The second is that the aperture where the product is extruded from is right at the tip of the cannula, so I know exactly, once I've got my cannula in place, where my product is going to be placed. So there is a real degree of accuracy with this cannula. And also it is rigid enough to ensure that we stay within the same plane. Okay, so we're going to insert the cannula just submucosal below the vermilion border, approximately 2 to 3 millimeters below the vermilion border. I can see where my cannula is in the submucosal plane, but it's in that submucosal fat, and I'm going to place a medium viscosity, high elasticity product in this submucosal fat in order to create shape and volume and restore the vermilion border back to its natural state. I'm going to reposition my cannula and just glide the cannula with very minimal pressure in the submucosal fat back up to the oral commissure, and I'm going to press and extrude no more than 0.05 mLs of my product, and I'm going to do a third pass a little bit more inferiorly, again just to really shape and volumize the body of the vermilion. Okay, and I'm just going to mold and blend this product into one cohesive layer under the mucosa. And if you just open slightly for me again. So the same process in the lower lip, keeping balance and proportional harmony. Again, I'm 2 to 3 millimeters inside the lip away from the vermilion border, and I'm placing no more than 0.05 of my product, repositioning the cannula, doing my second pass of no more than 0.05, and my final pass closer to the wet dry border. Okay. Again, I'm just going to blend this product again into that little cohesive sheet of product in the submucosa. Thank you. So you can see how easy this cannula will glide and stay within the submucosal plane. This will allow for a regular, smooth placement of product because we stay within the same plane, and it also very much minimises the trauma caused, the immediate inflammation, and the potential for bruising as well. So there's no force required in order to allow this cannula to find its position, and we're going to inject our final 0.05. Thank you. And finally, I'm just going to blend again. So we have now created volume in the body of the lip and strength within the vermilion border, restoring youth and health and natural beauty back to the patient's whole perioral complex. In order to create balance to Celia's profile and enhance the result that we've got from the lips, we're going to place a little bit of product in the chin just to bring the chin forward and a little bit inferior as well. So we are going to place a high volumizing product on the periosteum just underneath mentalis. I'm going to use a 30 gauge 1/2 inch TSK needle in order to comfortably place the product straight down onto the periosteum. And I'm injecting a bolus slowly of 0.4 in order to bring the chin anterior to its natural position. We're injecting nice and slowly in order to enhance the patient's comfort and also to maximise safety as well. I'm maintaining this 30 gauge needle at the periosteum. Okay, and I'm just going to do 2 small boluses just at either side of the menton of the chin in order to increase the apparent height of the lower third of the face. Perfect. And again, we're just going to mold this product into position. And finally, in order to complete the blend from the mid face into the lower face, and in order to improve the perioral area, we're going to use volume. Okay, so again, we're going to use a 25 gauge 1.5 inch cannula with a 23 gauge introducing needle. We're going to leave this needle in situ for approximately 5 seconds to ensure that we have not caused any vascular compromise. We're going to prime the 25 gauge needle, which is going to allow me to reach from the oral commissure back to the chin. I'm going to remove this introducing needle and introduce the 25 gauge cannula. Again, I know exactly where the tip of my cannula is, and this is where the product is going to be placed. And as you can see, the cannula will glide in the subcutaneous plane as comfortably as it did in the submucosal plane. And what we're going to do is just blend the transition from the mid-face into the chin to restore youth and to restore a natural aesthetic result. Bear with me, sharp scratch. And I'm going to try and just bring the cannula across to the mental crease and place a little bit of support. Okay, a little bit of arnica, please, and then we're done. In summary, we've used 0.6 ml of bilateral lips contour using a 30 gauge 1/2 inch TSK needle to create support in the philtrum column and the vermilion border. We've used a 25 gauge 1.5 inch cannula to deposit a total of 0.6 ml of bilateral lip shape in the vermilion. And finally, we've used 1 ml of volume place with a 30 gauge half-inch needle into the chin to create support and inferior placement of the chin. And finally 0.6 ml bilateral volume using a 25 gauge 1.5 inch cannula in the mesolabial area in order to blend the mid-face into the chin itself to create a nicer profile.